Dr. Martinez, in your practice, you do orthodontic work, don't you?
Yes, I do.
Yeah, tell us a little bit about it, of like the advances which have been made in orthodontic, who should get it. I understand there's a tremendous amount of more adults these days who do orthodontic work. And also there's this new thing, well, it's not really so new anymore, called Invisalign. Shed some light on the whole thing.
Sure. And I was actually going to mention that there are more adults now wanting to have braces. And actually, it used to be thought that after a certain age, you couldn't get braces, or I'm too old, because I've been a dentist for over 20 years, and as the years have gone by, I remember people's comments and responses to whenever you'd say, are you happy with that straight tooth or that crooked tooth, or wouldn't you like it to be straighter? And people say, oh, I'm too old for braces. And nowadays, actually, people come in asking for braces. There's a lot more out there, the internet. There's a lot of other adults getting them, so their friend has it, so why can't I get it? And it's actually very nice to see that more adults are interested in getting braces. They've gone throughout their life being very unhappy with their crooked teeth, and now they can actually do something about it. And yes, Invisalign is just one of the removable aligners that are out there. After Invisalign, there are other companies that have these removable aligners, and they're very attractive to patients, such as adults, because they don't like to wear the brackets. They call it those little wires that they have in there. And so that's one of the attractive things about Invisalign or the other aligners, is that they can actually wear them. They're clear. Usually people don't see them. If they work in an office, they can wear them while at work, and people don't even know they have them. Or if they have to take them off for a special event or a date or whatever that is, they can actually take them off. Of course, it slows down the treatment, but that's a technical issue that we could talk about later. But so yes, there are a lot of adults now inquiring and getting braces. It is achievable to have a nice smile. There is no reason why an adult in this day and age, with technology the way it is, cannot have straight, beautiful teeth.
So, wires, they came already a long way too. They are rather, they wouldn't be Invisalign like Invisalign. By the way, are Invisaligns really invisible? What do you think?
Are you talking about the Invisalign, the procedure itself?
Well, that tray, that aligner you put up and then you run around.
No, they're not completely invisible. It's just a clear plastic, clear see-through plastic, if you will. So they're not really invisible, but they're not your normal brackets with wires and rubber bands that your typical braces consist of. And it's usually a little tray that goes over your teeth, and it's an Invisaligner that, it's clear. So it's very attractive because you don't see it like you see your regular braces. Although I'll tell you, what the adults are used to seeing as braces are these huge brackets or these bands that used to go around the whole teeth and these huge wires. With the new technology, braces are very, very different. Braces are almost not noticeable anymore because they're little tiny brackets. They're very thin. Actually, there are some tooth-colored wires that you actually can use. So you don't necessarily have to use the wires. And so sometimes even that is just attractive now because the treatment in itself of regular braces has become very different. It's much, much more attractive than your old typical braces of when I was a teenager, what I used to see and what they're used to seeing. So, and even for actually teenagers nowadays, they're very self-conscious. They don't want to. They come in asking for the Invisalign because they've seen the ad on TV. They've talked with their friend that had it, and they don't want to wear, the girls specifically, right before prom or whatever, they don't want to have braces, how long they're going to have braces for. And so it's just become a very attractive thing to do. Invisalign, but also just in general braces, because braces are not what they used to be either.
So yes, there's something there. I even heard that, those places, especially for the teenagers, I guess, they put little, flags and footballs and all kinds of stuff on it. So it becomes like earrings, like a fashion statement.
Actually, you're right. I mean, I'll tell you, the retainers, usually the kids could ask for whatever design they want at the end of the treatment. But I'll tell you, even just my own daughter wants to have the rubber bands like the Blackhawks colors, black and red. So I mean, it's just become a fashion statement. So I think more and more nowadays, it's become part of who they are. For instance, I have a lot of kids asking me during football games, for their school colors of their football team. To have these rubber bands. So it's become a fashion statement, and it's not what it used to be. So they can get the Invisalign. If some kids just do not want to wear braces, it's just become where I can't do it. I don't want to look like a dork, they say. So
right.
We do have that option of Invisalign. Or for the adults that have to go to work, they have an office work, they don't want to wear the braces. Because, one of the comments actually I was thinking about right now that they tell me is that I don't want to look like my daughter, like a teenager. If I go to work with my coworkers, I don't want them to think I'm like this vain little girl. But, and it's not like that. But it's very difficult to change people's perception. So the good thing about dentistry is that we have options for everybody right now. We have options for people that want straight teeth but don't want to get braces. Or wear braces. We can do veneers. We can do the Invisalign. If people don't mind the brackets and actually want the fashion statement, we can do the brackets with colorful rubber bands. I mean, we have everything.
And in terms of outcome, on an average normal case, Invisalign versus old braces, are we talking longer or shorter treatment? Is the outcome relatively the same?
We are talking shorter treatment with Invisalign, given that they do wear the treatment as prescribed, because it is a prescribed treatment. The trays have to be worn for a certain amount of time, depending on the case, and so it depends on the treatment that is needed. That's the length of the treatment, whether it's brackets or whether it's Invisalign. But typically, Invisalign tends to be shorter because it tends to be not as complicated case, I guess, if you will. So, but it really depends.
So what you're saying is sometimes if a mouth or teeth in the mouth are very, very badly out of alignment, a Invisalign might not do the trick, and you might have no choice but going to braces. Is that what you're saying?
Exactly. You might have to, but also you can also do the Invisalign, but you have to wear it, and it really, I guess what I'm trying to say is it really depends on the severity of how crooked the teeth are. It's where we are and where we need to go, what determines the length of any treatment.
Right. But at the same token, obviously that discipline thing is important, which I think why it is sometimes, or why it was originally invented for adults, because a 14-year-old, takes it out at lunch, which is what I want to get at now. Those Invisalign braces, you take them out for eating so you can floss and brush the way you would be every day, where versus braces, that wire sticks in there, flossing and brushing becomes difficult, and sometimes that wire serves as a flagpole for the spinach. Being a 16-year-old girl having spinach hanging out from the flagpole might not be exactly what she wants on a daily basis.
Exactly. But you know what? I think it brings us to one point, is that any dental treatment that you have in your mouth requires some sort of responsibility on the behalf of the patient. And so whether it's Invisalign, whether it's braces, whatever it is, braces, brackets, or whatever, they need to take care of things. And so
it's just a different thing. With one, you need to make sure that you brush and floss a little more diligently than with the other one. On the other one, you got to make sure that you never forget to put them back in again. Otherwise, you get into a habit of not doing it. And next thing you know is your treatment will be prolonged or even failing maybe. I don't know.
Right. You're exactly right. Or even lose the aligner. So...
by the way, what about if you do lose one? I mean, things happen. You lose one, you step on it, it falls down, and you're in a restaurant in a bathroom, it falls down, and the next guy steps on it. I mean, what then? We're talking kind of like contact lenses. If you lost it, what would you have to do? You'd have to buy a new one. There are insurance programs that we have in place for such things like that.
but you've got to treat it just.
But you can make it. You can make a new one. So it's.
You can, but it will be. You can make a new one, but it's adding to the cost of a treatment already. So you have to, again, it comes with the responsibility of your treatment.
Okay.
The same way you wear contact lenses, you wouldn't drop one on, in the bathroom and have the guy next door step on it. It's the same thing with something very personal that you wear.
All right. Well, wonderful. Again, very, very informative and very straightforward and very candid. Thank you very much, Dr. Martinez.
Thank you.